So you have a vaginal bulge. You may actually have noticed some more pressure, having to lean forward or lean back to have to empty your bladder or to maintain a urine stream. You may have noticed more low abdominal pressure. You may have noticed that you have to push something up vaginally to empty your bladder. Or you may have maybe just noticed more urgency where you have to run to the restroom really quickly to empty your bladder, or more frequent bladder infections. If you've noticed any of these things, you may have a cystocele. You may be a woman listening to me right now and being told that you have a cystocele and you don't know what to do about it. You don't even know what it is. Well, in this video, we'll talk about it. This is Dr. Tugbiyele here, board certified fellowship trained urogynecologist in Atlanta, Georgia. My goal here is in this video to talk about what a cystocele is, why does it happen, what are ways to prevent it, and let's get into that. So a cystocele is a bulge of the bladder or a drop of the bladder. And it can happen due to many, many reasons. You know, women who've had children, due to pregnancy can do it. It's more common for a woman to have a drop of her bladder if she's had children vaginally versus women who've had just C-sections. But pregnancy in of itself can weaken the tissues of the pelvic floor for a woman that later in life can lead to a cystocele or a drop bladder. Women who it could be women who are heavier or higher body mass index can increase the risk of a cystocele. Excessive straining with bowel movements, constipation can cause cystoceles as well. Menopause, aging, gravity, those are other risk factors for a cystocele or a drop bladder. And when women have a drop bladder, they notice again a bulge in the vagina, difficulty emptying the bladder without the need to either lean forward or to push up vaginally or lean back to maintain the urine stream, getting more recurrent bladder infections, more urgency, waking up more frequently at night to empty the bladder, and some pressure. Even some women may actually have low abdominal pressure or low back pain as a result of a drop bladder. It is quite common, and as a board certified fellowship trained urogynecologist, I've cared for 1,000 women over the last 20 years with a cystocele. The point is, you don't have to live or put up with it. There are good options and solutions to effectively manage this and get you better and improve your quality of life. And so, what are some solutions? Well, one solution is not to do something about it, because not taking care of it it can slowly get worse over time. And so that is not an option to just leave it be and ignore it. A lot of women are embarrassed by a bladder drop. A lot of women feel they're the only ones who are experiencing it. They may not want to talk about it because, they feel embarrassed, but it is something that's quite common, and doing something about it is the first key thing to do. Some women who have a mild bladder prolapse can benefit from pelvic floor muscle exercises or Kegel exercises. And these are the muscles that women squeeze to stop the flow of urine midstream or to stop gas from coming out in an unwanted area or time. Exercising those muscles can help to improve pelvic floor tone. That can help to, in mild cases, relieve pressure, release some of the symptoms of prolapse. Some women may choose to see a pelvic floor physical therapist who will coach you on doing these pelvic floor muscle exercises even more effectively. I say 100 Kegels a day keeps the urogynecologist away, and a lot of women do Kegels, but a lot of women have told me, Doc, I've been Kegeling all my life and it's not helping. And so seeing a pelvic floor physical therapist can also be helpful, especially if in the initial stages and the symptoms are mild. That can improve a woman's pelvic floor tone, and that can help with a bladder drop. Now, when a woman comes to see me as a pelvic floor urogynecologist, we grade the prolapse during a physical exam. Grade 1 or stage 1 prolapse is where the bladder has dropped halfway into the vagina, but it's not at the opening to the vagina at that time. A stage 2 or grade 2 is where the prolapse of the bladder is at the opening to the vagina, and it's at that point that women oftentimes will say they can feel or see it. When the prolapse of the bladder protrudes through the opening to the vagina, that's a stage 3 or a grade 3. And when it's all hanging out, then that's a stage 4. And so a stage 1 or mild prolapse is oftentimes a time when pelvic floor muscle exercises or Kegel exercises or seeing a pelvic floor physical therapist can be the most effective. When the prolapse is at a stage 2 or more, where the bulge is at the opening to the vagina, strengthening the pelvic floor muscles may not be as effective. And so at that point, a woman can be fitted with something called a Pessary. Now, Pessary is a device. There are different types of pessaries. The most common ones we fit in the office is a ring pessary, which looks like a small ring-sized device, and it gets fitted in the vagina. It's made of silicone. It gets fitted in the vagina, and it helps to support the bladder and reduce the bulge. And it's a device that, when it's the right fit, a woman doesn't see it, doesn't feel it. It's not too big that it hurts. It's not too small that it falls out, just the right fit. And so that is something that can be fit in the office to help to relieve symptoms and to help to keep the prolapse from getting worse. Some women may feel that this is like a Band-Aid where, and I get it, it's not necessarily going to make the prolapse disappear, because when you're not wearing the pessary, then the prolapse comes back, but at least it relieves symptoms while it's in there. So I've had patients who've noticed that, yes, when they notice that the prolapse bothers them during the day, maybe when they're exercising, maybe when they're on their feet. And so if that's the case for you, then yes, being fitted with a pessary can be helpful during those times where you wear it during those times, maybe during the day, during exercising, and then take it out at night. And when the prolapse naturally recedes anyway, and a lot of women feel that manages their symptoms and it fits into their quality of life. One of the things about a pessary is that it oftentimes has to be removed for sexual intimacy and intercourse. So a lot of women will choose to learn how to remove it, clean it themselves, and put it back after being intimate so it's not in the way, and it of course relieves the symptoms when the prolapse is there. And then lastly, in a woman who is choosing to just have this fixed and rather not wear pessary or hasn't really benefited from pelvic floor exercises, then there is surgery. I'm a pelvic floor surgeon, and I understand that no woman wakes up in the morning and says, oh yeah, I want surgery. No woman, right? And however, if it seems to be that's the next best step to have this addressed, then yes, thankfully there are solutions and simple surgical solutions to help nip this in the bud and help it improve. And it could be as simple as a vaginal procedure where we use suture material to support the vaginal tissues and to help to relieve and reduce the bulge of the bladder back into its normal position. There are times when this can be done either vaginally or laparoscopically, robotically as well. And if it's caught early, oftentimes a woman's natural tissues can be used to resupport the bladder. And so the main point is that a woman, you don't have to live or put up with this. There are good options and safe solutions that can help to improve your quality of life, your confidence, and help to improve the way you feel and reduce the bulge so that you can get back to doing the things you enjoy. Imagine having to go to you can empty your bladder and not have to lean forward or stand up, sit down as someone may have to, or being able to do the things you enjoy, exercise or go out outing with friends, and being able to enjoy those things that improve your quality of life and not have to feel like you can't do anything because you have this bulge between your legs. And so, yes, so there are good, safe solutions and options. And if this video was very helpful for you, please do like and share it. Another woman will thank you for that. And subscribe to my channel because there are a lot of videos that I will be producing, and I've already produced some. And so that'll help. You can be notified with the next video that I produce. And if you're a woman who has a cystocele, you've tried things on your own, and you want to take care of it in a more proactive way, and you're looking for a urogynecologist, board certified, fellowship trained that you can trust and who will listen to you and take care of this because of the expertise and compassion with that, then I invite you to work with me. And you can reach me two ways. One way is by my website. That's www.drtugbiyele.com. You don't have to memorize it. It'll be in the description, and there's an inquiry form on my website that you can fill out, and that'll get to my team, and then we'll help you schedule a consultation with me. Or you can call my office number, 470-325-1280. That's 470-325-1280. And those are two ways you can reach me. And until the next video, I'll see you in the next video.